Assalamualaikum warahmatullahi wabarakatuh. A very good afternoon for all of us. Bapak Budi Gunadi Sadikin, the Vice Minister of State-Owned Enterprise, Head of the National Economic Recovery Task Force, honorable colleagues, esteemed foreign correspondents, thank you for the time that making yourself available to take part in this press briefing because of the COVID-19 pandemic has taught all of us and over again the time is for the essence, and we know that the pandemic came to our doorstep in an instant, and we were shocked, everybody shocked, and the whole world also was shocked. Even when President Joko Widodo has issued the Presidential Instruction Number 4, 2019 on enhancing our ability to prevent, detect, and respond to outbreaks of diseases, global pandemics, and nuclear, biological, and chemical emergencies on the 17th June 2019. We did not enjoy the luxury of time to build capacity to face the next non-natural disasters. But panic was never the answer, we know that. We had to move very fast, save lives, protect our people, because time is of the essence. The distance between us and the virus that we need to protect our communities were getting closer. Then we limit our activities. We stayed home to buy time, to distance ourselves from the novel virus. The numbers are enormous. We had to avoid their massive attack, and we have to learn how to stop it. When we decided such a move, time did take a side. That short circuit breaker that we did a few weeks ago managed to give time and room to our scientists, to our experts, to come out with a more holistic, comprehensive view of not only protecting ourselves, but to get out of this pandemic with a legacy. A legacy to be passed on to our children and grandchildren. What we are about to tell us is what 6 months have given us. For us is 174 days to solve the mystery of the world is not sufficient enough. Let me remind you that we dealt with the crisis and emergency responses back in March and April. So like most of every other policy maker across the world, our priority is to save lives. And thus time relatively passed too quickly. For the members of the public, and maybe for some journalists, 1 semester is too long. Many of us imagine a quick turnaround and instant change in situation. Many started comparing Indonesia with an administration area that is populated only by half of Jakartans or the size of Surabaya. Many of us started comparing us with a landlocked state and somehow forgot that Indonesia is the largest archipelago and the 4th most populous country in the world. It has a total of 17,508 islands and stretches as far as 54,716 kilometers. And thus, let's discuss Indonesia in the context of Indonesia, its complexity and its exceptionality, and here are the numbers that reflect them. First, I would like to summarize the COVID-19 cases in Indonesia as per 1st of September 2020. With the total confirmed cases in Indonesia is 177,571, while there are 40,009 active cases, or 23.7% of total confirmed cases. We have reached 128,057 people recovered, or 72.1% of total confirmed cases. We are still having a big challenge at death number. which is 7,505 deaths, or 4.2% of total confirmed cases. If we look at the worldwide number, our active case percentage is still lower than the worldwide, which is 26.67%. Same goes with recovered percentage. Indonesia is higher than the worldwide, which is 70%. Death rate worldwide is 3.32%, which is lower than the Indonesia at this rate. All of this number makes Indonesia rank 145 of 215 countries in total cases per 1 million population, which is 648 cases per 1 million population. In total recovered, Indonesia is in the top 20 countries with the highest recovery, with total number is 128,057 cases. We have to work harder to suppress the death numbers. We understand this, since we rank 19 of 215 countries in total death, which is 7,505 cases. Next, I would like to show the percent of active case at national level. If we look at this percentage, the graph of the development of active cases from March to August continues to decline. In March, the average percentage of active cases was 91.26%. And these figures continue to decline in April to 81.57%, in May to 71.53%, in June to 57.25%, in July to 44.02%, until last month, August, active cases in Indonesia decreased to 23.64%. It is good news that active cases in Indonesia continue to decline. We need to protect the situations together so that active cases in Indonesia continue to decline every month until COVID-19 completely disappear from Indonesia. Similar to the development of active cases in Indonesia, the development of the percentage of death at the national level also tend to decline. Even though it reached its peak in April, in May, June, July to August, the death rate at the national level continued to decline. In March, the average percentage of the death in Indonesia was 4.89%, and increased to 2 times in April, namely 8.64%, and in May the percentage decreased to 6.68%, and in June to 5.56%, in July to 4.81%, and finally in August to 4.47%. Although the percentage of death at the national level has experienced positive changes, it is still above the global percentage. This is something that we must fix together and work harder to ensure that the death rate at the national level continues to decline until it is below the world figure. And next, I would like to show about the recovery case at the national level. The percentage of recovered cases at the national level continues to increase, even higher than the percentage in the world. In March, the average percentage of cases cured in Indonesia was 3.84%, then increased more than 2 times in April to 9.79%, then increased again in May to 21.97%, and continued to increase in June, July to August respectively, 37.19%, 49.4%, and 67.04%. As of August 30, 2020, the percentage cured cases in Indonesia reached 72.17%. This need to be maintained, even increased, so that recovery in Indonesia continues to increase and is above the world average. Fast and precise handling as well as good quality health services greatly affect the percentage of cure in Indonesia. Continued with the positivity rate at the national level, if we look at the positivity rate at the national level, Indonesia continued to increase. In June, the positivity rate in Indonesia was 11.71%, then increased in July to 14.29%, and in August, it reached 15.43%. The positivity rate in Indonesia once reached the highest figure, namely 25.25% on August 30, 2020. This is a big challenge for Indonesia to reduce the positivity rate to reach the WHO recommendation, which is 5%. Fast and precise mitigation, increased laboratory testing capacity, and massive tracing are the keys to suppressing the national positivity rate. Next, I would like to mention about the risk zone maps. This is an approach to regional control because the size of Indonesia. The zoning mapping is carried out as form of approach to evaluate conditions at the district and city level using existing data generated from the situations in the field. Red, orange, yellow, and green are selected based on the color of the disaster, commonly used to identify regional risk, and are determined based on several indicators recommended by WHO. The accuracy of the calculations depends on the availability of the data, and the quality has been increased from time to time. We ask for help and support from all relevant sectors, such as local government, the Ministry of Health, so that the completeness of the data required for calculating public health indicators can be available properly, and the quality of the accuracy of the risk zone can be improved in the future. Once again reminded, there is no safe area in Indonesia even though it is green. We still have to be vigilant wherever we are and apply health protocols by wearing masks, maintaining distance, and also washing hands. The risk zonation, as you may see, that we map Indonesia and give the zonations based on the data that they have. And we have the high-risk areas, which is 65 regions and cities. The medium risk is 230. The low risk is 151. The areas with no new cases is 42 regions and cities. And lastly, the non-affected areas is 26 regions and cities. And if you look at the regional risk zone changes in Indonesia, starting from May up to now, every week we monitor that, and it shows that the high-risk area percentage reduced from time to time, and it moved to the medium risk and low risk, and you can see that the size of the area with the medium risk and low risk are increased compared to the red and also the green. And we need to make sure that we can save the green, never been affected, and also we have to make the areas where high risk, whether it's low or medium or high, into the green where they can handle the cases with zero new cases, and all of the patients handled are recovered. The key acceleration of COVID-19 mitigations is related to the improving testing, tracing, and treatment. And for the last 6 months, National Task Force Team, Gugus Tugas, which changed into Satuan Tugas, already done several activities as response to national disaster emergency, which stated, especially in testing with procurement of PCR mobile to enhance speed of testing in every district and cities, and increasing amount of testing laboratory, also COVID-19 referral hospital. For now, the biggest challenge is holding the testing massively, thus the testing amount has not reached WHO standard. WHO states the testing standard for testing per week is 1 per 1,000 population. In fact, Indonesia population is 267 million, so that at least Indonesia testing has to be 267,000 person per week, which this number are still far away from recent condition, which the highest amount only reached 95,000 person per week. And our strategy ahead is increasing tracing and testing rate equally by program intensifications in primary care, especially at the healthcare centers or puskesmas. Besides that, optimizations of health facilities by enhancing effectiveness and safety from the health forces itself. And Indonesia has advantages in structural arrangement, healthcare facilities like puskesmas, which coordinate with integrated healthcare center or posyandu, health cadre, and other potentially enhancing prevention and mitigation of COVID-19 handling case. To support those things, increasing laboratory performance by active participation from all parties, which include private sector, in order to reach inclusivity. As being instructed by the President, we put focus on boosting our testing, tracing, and treatment capacity. Up until September 1st, the amount of specimen tested is 2,270,267, and the amount person tested is 1,312,477, and the positivity rate per September 1st is 18.5%, although some of the areas have a lower positivity rate below 10, but has not reached the 5%. During the pandemic, valuable health workers have always been our priority groups that we must protect. The recent spike has put burden on our health workers. We are targeting to reduce the health personnel COVID-19 infection and mortality rate by 50%, infection rate from 10.02% to 5%, and mortality rate from 0.028% to 0.014%. Further efforts to protect health workers, such as clinical work arrangement that reduce the length of exposure for each health worker, arrangement of the working hours for health workers with adequate rest periods, standardized personal protection equipment provision, and supplements and incentive provisions. We would like to mention that there are several innovations made by the government of Indonesia with the involvement of all stakeholders in Indonesia, is to develop and protect the valuable PPE coveralls with 100% materials made in Indonesia. And this being produced by more than 30 domestic manufacturers, and the capacity is 17 million gown per month, and it's made from polyester, which is produced in Indonesia. And with this, we call it INA United, because the spirit of united to fight against COVID-19. And this has met with the international standards of AATCC and ISO, as well as ASTM. The other innovations that we made to save critical patients is with the development of the ventilators, which is 100% made in Indonesia by collaborations between university and also private sectors and state-owned enterprises. And we finally have developed this using 100% domestic materials manufactured in Indonesia and clinically approved, and to be internationally standardized soon. And I think this is the advantage of having the COVID-19, which increase the innovation ability of the multi-sectoral collaborations to have these innovations. And then also the innovations about having mask, the cloth mask, which we want to make sure that the people who wear masks is really wearing masks with a good quality, and we develop and support the textile industry to develop materials that is have a filtration ability high enough, which is more than 88% for the viral and particles, and also the bacterial filtrations up to 99%. And we will be providing support to the public with this cloth mask with the plus ability to filter viruses. And then also about vaccines, COVID-19 development. As countries around the world are racing for a COVID-19 vaccine, joint efforts are initiated by the government of Indonesia, consisting of international collaborations and national vaccine development. And within the international cooperation corridor, we have secured several commitments and access for vaccines. The first one is collaborations between Bio Farma and Sinovac. The second one with Kimia Pharma and Group 42. And the third one is collaborations between Kalbe Pharma and Genexin. Outside of these efforts, the Indonesian government has also reached out to other countries for vaccine collaborations. In effort for the national independence on COVID-19 vaccine, Indonesia is also developing the Merah Putih vaccine within a national consortium by the Ministry of Research and Technology, the National Research and Innovation Agency, and the Ekman Institute for Molecular Biology. We received the President order yesterday to suppress cases in coordinations with regional heads, with the governors, and of course with mayors and district heads, that we want to make sure we follow the order, and we want with the unity that we have, with 34 provinces that we have, 514 districts and cities, we want to make sure that the data figured movement of the COVID cases will be handled carefully, and we have to work hard to make sure that all of the areas can suppress the cases. And a reflection of learning for the past 6 months, we set 8 targets at the National Task Force for COVID-19 handling. First is to make sure that we protect the vulnerables, especially the protecting comorbid sufferers, elderly, including the health workers. And then second, our target is control cases, which is control the active cases, improve the cure, and decrease mortality. And then the third is improving testing, tracing, and also treatment, which we need to increase an equalizations of testing to 30,000 people per day, contact tracing, and strengthening also the treatment. And then the fourth is vaccination, creating conducive situations and conditions for the COVID-19 national vaccination program. And the fifth is reagents, PCR, and PPE. We want to make sure to increase the availability of the reagents, PCR, and PPE for health workers and health facilities across Indonesia. And the sixth is massive socializations, using all national resources from top to the bottom level. And then the seventh is behavioral change, which promote health protocols, compliance of behavior change, which adapt with the local culture and wisdom. And then the last one, but also important, is the interoperability of the data, which improve the health, economic, and social information together. As closing, esteemed colleagues, distinguished ladies and gentlemen, now we all have seen the numbers, all done in less than 200 days for the sake of the 270 million people in 34 provinces and 514 cities and districts. But we have something that goes beyond the numbers: solidarity, unity, and gotong royong. In Satgas Penanganan COVID alone, the 200 billion donation funds reflect only a fraction of what all Indonesians give to each other. 30,000 registered volunteers are those who are ready to fight in the front end, and another 15,000 medical students who also sign up as volunteers, ready to be posted across archipelago. Thousands of volunteers from Nahdlatul Ulama, Muhammadiyah, Christians and Catholic communities, Hindu, Buddha, Confucius, and other religious groups are coming together to help one another so that our people tidak terpapar dan tidak terkapar, protected from the virus and are not suffering due to the economic hurdles. Our villages remain strong and produce their harvest, feeding the nation and ensuring we consume nutritious food, which is important to protect ourselves from COVID-19. Musicians, artists, actors, celebrities, even stand-up comics roll their sleeves and find solutions to the President Jokowi's call of Produktif dan aman COVID-19. Stay productive, but stay healthy. And the women, the moms, and our children, they joined the band of COVID-19 fighters, campaigning relentlessly for adaptasi kebiasaan baru, a behavior change campaign that we should embrace toward a new era where healthy behavior is the prime social norm, connectivity and digital engagement are mainstream, and resilience is the pride of the nation. This is the true color of Indonesians, and we hope to show that more and more to the world. We understand this in a world full of problems and chaotic issues. You may also lose sight and focus on your concentration. You can lose sight of it all, but it makes you feel so small. But Indonesians can show their true colors. They can shine through. We can make diamonds out of rocks. We have shown our resilience through many tests, but it gaining independence, coming out of the poverty, overcoming political crisis, surviving global economic disasters, rebuilding tsunami and quick hit areas, and we will do it again. And it's the world that need to remember that 250 million of their inhabitants have such resilience and solidarity. We may be the rainbow that you look for after the heavy rain. Like the rest of the world, we believe this too shall pass, but we aim to become stronger, better, and healthier as a nation. And as a member of the global society, we put our trust in the notion of the national unity and global solidarity. Inshallah, thank you and stay healthy and stay resilient. And next will be continued by Bapak Budi Sadikin. Thank you.
Good afternoon. Many of us, including myself, has seen economic crisis several times, global economic crisis. I remember my first global economic crisis was in 1998, and then followed by another one in 2008, and followed by another one again in 2013. For me that spent more than 25 years working in banking industry, I noticed it different. The last three global economic crises was initiated by a financial crisis, but not this one. This economic crisis was initiated by a health crisis. And for me and many other people, it is actually the first time all of us experience this type of crisis. A different crisis that needs a different policy response to address this crisis. Many people are asking, why this health crisis can become economic crisis? My humble observation is because this health crisis need a lockdown, reducing the physical activities of people, and then these physical activities actually are the main pillars of the Indonesian economy. So however we would like to change these physical activities to digital or virtual activities, it still cannot be as effective as a normal physical activities in pushing the Indonesian economy. So we realized that to solve the economic crisis, we need to solve the health crisis. But President Jokowi he is, and he will always reminded all of us, all of his team, that the priority is on health issues. We have to solve the health issue first. Then we will solve the economic crisis first. So that is the reason why the health person come first after me. And it's also, if you see the title, the tagline of this committee is Recovering Health and Reviving Economy. That is the reason why the economy word is under health. So because again, the focus of this crisis, if we can solve the health issues, then we will definitely solve the economic issues. So ladies and gentlemen, again, my job here is to bridge the gap, to give the support that during this health crisis, the economic activity cannot move very, very fast, that the people of Indonesia at the bottom of the pyramid, especially also the small and medium enterprises that provide jobs to more than 90% of Indonesian people, that provide support for more than 55% of Indonesian economy, is supported by the government. But again, our role is to give support. Our role to bridge the gap until the people of Indonesia feel secured, they can go outside and do normal activities, and then the economy of Indonesia will move again as normal. So ladies and gentlemen, let me share with you, that is the reason why the President 40 days ago, around 40 days ago, so it is not my 6 months in the job, is my 40th days in the job, established this team. It is chaired by Pa Erick Thohir, and they have two head of task force, one related with health, which is Pak Doni, and the other one is related with economy, which is myself. And then, again, we have 3 priorities, which is given by Pa Erick and also Pa Erlangga. Those 3 priorities are, the first one, again, is focusing on healthy Indonesia. How can we establish back? How can we revive back a healthy Indonesia? And then it will be followed by my job, which is how to make Indonesia work again, how to make Indonesia grow again. Now, the total amount of money that is allocated by the government for this team to push until the end of the year is around 965 trillion, which is what will be my focus, or our team focus will be 4 items below. So we will focus on the social safety net to make sure that the poorest Indonesian at the bottom of the pyramid get supported during this difficult time. We will focus on the small medium enterprises, as I mentioned to you, because they provide jobs to more than 90% of Indonesian people. They also contribute to more than 55% of Indonesian economy. But we are also supporting all the ministry and regional initiatives, and we're also giving some incentives to the corporations so they can keep hiring people, and the people can still work at the companies. The first 2 boxes will be the responsibility for the health task force and also the Ministry of Finance, because we are talking about business incentive is more related with tax. So again, my job is to focus on the 4 boxes, which is, if I calculate the amount, is around 400 trillion, around 400 trillion. And what that has been realized now is close to 200 trillion. So one of the mandate given by the President to us to make sure that we need to accelerate the disbursement of this fund. So we can push the economy, we can propel the economy, we can drive private consumptions and also corporate investment until the end of this year. So if you see those 4 boxes, the gap that we have to reach between the budget and the realization is around 218 trillion rupiah. So again, the total budget is around 695 trillion. What is related with the economic task force is around 400 trillion. And we have around 218 trillion gap that we have to fulfill until the end of this year. And let me share you with some of the detail of the program. There are many programs on this overall task force program. But again, I would like to concentrate on several big ticket items that we believe can give the biggest impact to the people, especially the bottom of the pyramid, our fellow Indonesian, which is not as fortunate as us, and also to the small and medium enterprises. What I would like to share with you is, out of the total progress that we have achieved, it's different from week to week. Because since 40 days ago, when we are being established, we are pushing, synergizing, working together with all the ministry to make sure that we can accelerate the disbursement of the fund. We can deliver around 45 or 44 trillion in the last 3 weeks. So if you use the pace, we have September, October, November, December, 16 weeks. My calculations, if we maintain the pace of 45 trillion in 3 weeks, we can disburse around 222 trillion, which is already more than the gap that we have, which is 218 trillion. Let me share you some of the detail. This is one of the biggest social safety net program that we have. We call it program Keluarga Harapan. It is given to the 10 decile lowest family, the poorest 10% family in Indonesia. So if every family has around 4 members, it is targeted to the poorest 40 million Indonesian. And until now, out of the 37 trillion budget, we already disbursed around 27 trillion. We are convinced that by the end of this year, we can achieve this number. By the end of this year, we can achieve this number. I give you another program. We call it program Kartu Sembako. Instead of targeting the lowest 10 million families, this program targeting the poorest 20 million families in Indonesia, or around 80 million people. Again, this program has been launched, and until now, we already disbursed 27 trillion out of the 43 trillion budget. And we have a very strong confidence, but by the end of this year, we can achieve the target. Those are the 2 programs that is close to target. But I would like to share with you also some of the programs that we are still struggling how to achieve the budget. The next one is the social safety net that we are transferring to the villages of Indonesia. Out of the 32 trillion budget, until now, we can only disburse 10 trillion. We discussed and we realized that we need to modify the methodology to transfer this. Instead of giving the money directly to the poor people there, which maybe is already have access to another programs, we realized that we can use the rest of the money for other program as long as it is stay at the villages in Indonesia. So this is one example. When the task force was established 40 days ago, we realized that some of the programs are good, some of the program is not as good as what we would like to be, then we do something to improve. We do something to improve. And I will share with you also another one that we believe we need to do some improvement. It is the program to subsidize the interest rate of the bank loan given to small and medium enterprises. We allocated 35 trillion, but until now we only realized that we can only deliver 3 trillion. However, this 3 trillion is already given to 7.8 million SMEs. So then we realized that again, maybe the way we are budgeting the numbers is a little bit too aggressive. So what we would like to do is to adjust the numbers and take some part of the budget to do another productive programs related with SMEs. Because as I mentioned with you before, SMEs providing jobs more than 90% of Indonesian people, and SMEs also supporting more than 50% of the Indonesian economy. The President is very, very clear, mandating to us that we need to focus to address the poorest Indonesians and also the small and medium enterprises. And let me share with you 2 of the programs that we just launched in the last 40 days after the task force has been established, and we feel this will support us to accelerate the disbursement of the fund. The first one, we call it Bantuan Presiden Produktif Usaha Mikro. This is a grant given to small and medium enterprises for them to use this as the initial working capital. It is targeted to 9 million up to 12 millions of small medium enterprises, and we are happy because it is just 2 weeks and we already can disburse 7 trillion. We strongly believe that we can achieve the numbers on September and accelerating, the disbursement of the budget. The President are also very happy, and he is personally doing it, delivering this program in Aceh, in Jogja, and many other cities after this. The next one that we just launched also is we program Subsidi Gaji, or this is the subsidy, the amount, the grant that is given to workers, formal workers or informal workers registered in companies in Indonesia that pay BPJS, what do you call it, the Workers' Insurance Facility. We have identified 15 million workers, and these workers, because the company is not in a good shape, some of them, they have salary cut or they are sent back to home because the company is not being able to pay the normal salary. So we realized there is a specific segment outside of more than 80 million Indonesian, the poorest that we have been able to identify and give direct subsidy that need to be supported. So that's why we built this program. And this program, in the first week, we already able to disburse around 3 trillion through this program. And we strongly believe we can achieve the numbers. The President several times mentioned that let's try the best to make sure in this quarter we can have a better economic growth. To give you the feeling of the numbers, Indonesian GDP is around $1 trillion or 14,500 trillion rupiah. So if we divide by 4 to get the quarterly GDP figures, each quarter is around 3,600 trillion. So if we are talking about last quarter, we have a negative 5% growth. What we are talking is 5% of 3,600, which is around 180 trillion. So if we can disburse 180 trillion funds every quarter, that is exactly the minus 5% GDP growth. So that is the target that we are aiming. We need to at least give or disburse around 180 to 200 trillion every quarter to make sure we can sustain Indonesian economic growth. I will end this presentation by saying that, we realize humbly that it cannot only the program of the government of Indonesia. For us to survive this pandemic, it cannot only be launching programs of the government of Indonesia, but we need to create a movement of the people of Indonesia. We need to use all social capital that we have, of our friends, of you journalists, of every people in Indonesia and every corner of our country to work together and overcome this pandemic. I strongly believe it is too heavy for the government to handle this alone, but it will be able to be achieved if we work this together. Reminded me of a speech given by one of the head of state of Africa when I had an opportunity to be in Davos. He said, if you want to go fast, then you go alone. But if you want to go far, then you have to go together. Good afternoon, and thank you.
Now I would like to respond to several questions that have been posted by the journalists. Thank you for the questions. First is the questions asked by the ABC Australian network. Why is the number of the new cases significantly rising in the past week? So the outcome that can happen because of the several reasons, and we know that the important thing is that because of the increase in the testing, it will contribute to the increase of the number detected. But also, we understand with the activity going around in the community, the transmission happened in the community, and it contributes to the increased number of the cases in several areas, including in the big cities. And it is also related to the long weekends occasion, where it seems that the some of the people were improving the gathering, and this reflects on the cases that we found now. And we always make sure that and campaign that all of the people, this is still pandemic, and we want to make sure that they have to wear mask, wash their hands, and have a physical distance during all times in the public area. And they have to avoid the gatherings in the community. And then the next question is from Associated Press, Jakarta Bureau. How is your opinion about high number deaths by COVID-19 in health workforce? What is the main cause, and what government and task forces team respond to it? We deeply sorry to our hero, the health workers, the frontliners, the fighters that who passed away while handling COVID-19 treatment. And both the task force and the Ministry of Health together are very concerned of this issue since the beginning of the COVID-19. And it seems that in the past weeks, the number of the deaths increased, and especially in related to the health facilities or hospitals that are full of the COVID-19 patients, while also being used by other or non-COVID cases. And now we try to move the patients to Wisma Athlete Hospital, and also so that free up some of the spaces for the COVID-19 with the heart or the cases that need to be handled at the referral hospitals. So hopefully that the number of the beds available increased, and the tension of this or the pressures to the health workers also reduced. And then the third question is from DW. Last April, President Jokowi predicted that the spread of corona cases in Indonesia would start to slump in July, but daily data showed that corona cases continue to increase. What went wrong? We realized that the positive case increased in the past months, and the President has released the presidential instruction on August 14th on the enforcement of the health protocol to all of the local leaders, the provincial leaders, and police, and also armed forces, to make sure that the people follow the orders to health protocols. And we are trying to improve the testing, the tracing, and the treatment to make sure that the situations is handled carefully. So I think those are the three questions that answered for the international media. Again, thank you for the questions. And next, I would like to ask Pak Budi to answer for the questions that related to the economic issues. Thank you.
Is there any questions related with economy?
Good afternoon, Pak Budi. There is one question from Saiful from Channel News Asia. With Indonesia is on the brink of a recession and challenges on the disbursement of social aid, what is your assessment on the solidarity and community spirit of the Indonesian people?
I think the best answer would be the Indonesian answer it for themselves. But let me share with you what I have seen personally related how Indonesian responses to this crisis. During the mid of the crisis in April or May, I was assigned by Eric to handle the state-owned company hospital, and also to help Garuda, because at that time Garuda have a crisis. And to my surprise, while nobody is taking Garuda flight, many people, private sector, professionals, they come from different professions, come to call me and ask me whether we can charter a Garuda flight. I'm extremely surprised. What do you mean chartering a Garuda flight? Oh, Pak, we have contacts in China, because China is already have this pandemic before, so they have a lot of protective suit. At that time, the problem is with protective suit. We don't have enough protective suit. So what happened is, this Indonesian with a different background, some of them are Chinese, some of them are Javanese, some of them are Bataknese, you know, they just contacting the friends in China, buy the protective suit, buy their money, with their money, their own money, not state-owned companies' money or government money, and then they start looking for how can we transport that back to Indonesia. And they ask us whether we can contribute in providing a chartered plane that will be filled with the protective suit that they buy. So I'm very impressed that these Indonesians, without someone orchestrating them, quickly by themselves, creating contacts, establish contacts, and secure the protective suit that we can bring and then distribute to all of the needed hospitals in Indonesia. The second funny experience that I also saw personally is I have a friend, a famous TV anchor, Najwa Shihab, you know, and we are talking about, can we do something about this? And she said, I want to establish a concert, a virtual concert, and inviting some of her friends into this virtual concert. And then we have to donate. If we watch this concert, then we have to do donations. And to my surprise, in 3 days, the amount of money coming in is around 4 billion rupiah. That's a serious amount of money. 4 billion rupiah. Just for forgive my word, unorchestrated, unwell-planned virtual concert by people prepared in 1 week to do it, launch in YouTube, and then everybody participate, and then they pay. And we collect the money, or not we, but she collect the money, 4 billion rupiah, and distribute to all the needed hospitals and people. That impressed me a lot. That is the reason why I said mobilizing the social capital of our people is extremely important. If we can do this, if we can, reshape the formulation instead of pushing government programs for the people of Indonesia, but instead of doing that, we replace that creating a movement of the people of Indonesia, we will succeed.